Hi, I'm Dr. Bill Gradishar from Northwestern University, and I'm pleased to participate in this Yerbba video on exercise. And the reason we're focusing on this topic is because it's one that patients often ask about, and they try to understand whether exercise might be useful for them, both in terms of treatment effects as well as whether it can decrease the risk of the disease returning. And exercise, again, is important for all people. Not only obviously for your overall sense of well-being, not only because it makes you in better shape, gives you a better sense of yourself by doing some form of exercise, but at a biologic level or a cellular level, there have been clear links to the effect of exercise on cellular mechanisms. So what's the consequence of exercise and breast cancer? Well, we have evidence from clinical trials that have explored the value of exercise in terms of reducing the risk of the disease returning. So if somebody has an established diagnosis of breast cancer, if you participate in specific exercise programs, how does that affect your risk going forward? And those studies have suggested clearly that you can reduce the risk of breast cancer recurrence. There's also some studies, more limited, in patients with advanced disease who exercise that can impact on overall survival. So what are the recommendations for exercise? Well, number one is start. And, again, if you're somebody that doesn't do much of anything, trying to get about 150 minutes per week of moderate level exercise is important, or 75 minutes of vigorous exercise. And why is that important? Well, it's been shown in preclinical and clinical translational kind of work that what exercise does is multifactorial. Not only does it improve your exercise capacity, it improves your sense of well-being just by exercise, but at a cellular level, it can have a number of different effects that are potentially beneficial, including decreasing the amount of estrogen that is around in your body. So obviously, if you're losing weight in the midst of exercise, vigorous exercise, less estrogen around, less sex hormones around, and this could have a beneficial effect in terms of reducing your risk of recurrence. And how does that happen? If you can modify your weight, meaning you exercise, your weight goes down, there's less fatty tissue that's converted into estrogen. It also can decrease inflammation and improve actually your immune system. Natural killer cells can be increased by exercise, and they play a part in fighting cancer. It can decrease inflammation, and inflammation as well contributes to not only the development of cancer, but also recurrence. So eliminating that or reducing that is important. Maintaining muscle mass is critically important. So even though we've talked about potentially exercise decreasing weight, at the same time, we don't want you losing muscle mass, because muscle mass is important for maintaining your blood pressure, your sense of mobility, your sense of balance. So there are a number of studies that have been done, both preclinically, animals, as well as in patients, human beings, that suggest that in the setting where a patient has a diagnosis of cancer, exercise has a very positive effect on overall outcome. So it's something that's modifiable, and by that I mean this is something a patient has control over. They can actually elect to do this. You're not taking a drug. There's no one standing over you telling you you must do this. It's something that you can take on yourself. And if you even do it in a modest way, starting out slowly and building, it's important. And I think the other key piece is when we say move, it could be walking. It doesn't have to be running. But the other component of exercise that's important is also resistance training and strength training. And these things are all part of an exercise program that will help your overall sense of well-being and potentially, as a downstream effect, have a positive effect in terms of your overall outcome from a cancer standpoint. So I think treatment is important, it's critically important, but of course the things that you're able to do on your own are also things you have control of and can modify the outcome of patients with the diagnosis of breast cancer. If you'd like more information about your own individual situation, you can go to Yerbba.com, where you have the opportunity to interact with experts who can tell you about your individual situation and the different options you have and what the upsides and downsides of those different therapeutic options may be. So we talked a little bit about getting up and moving, which could be walking, or if you're so inclined, running or jogging. That's important, but strength training is equally important. As patients undergo therapy, they often lose muscle mass, and this is important. It helps your, in other words, muscle mass is critically important for maintaining your overall strength, but it also helps maintain your blood pressure. It helps maintain your balance. The other thing that's quite common, if you watch TV at any time in the last year and a half, 2 years, is a lot of people are on GLP drugs. And one of the consequences of GLP drugs, including in patients with breast cancer, innumerable of my patients are taking these drugs, is it decreases muscle mass. So again, there are multiple reasons why muscle mass may decline, not just the cancer, but other things that patients are doing. And it only emphasizes the need to do strength training and resistance training to maintain that muscle mass and build it, which is not only a function of exercise, but also a function of what you eat. So all these things are critically important to add to your overall sense of well-being as you go through treatment, recovery, etc. It's no surprise that as patients undergo therapy for their cancer, they may not feel at the top of their game. And I'm not only talking about patients who may be undergoing chemotherapy, where there are a spectrum of potential side effects a patient could be experiencing, but also includes anti-hormone therapy that also are associated with some side effects, as well as recovering from surgery or recovering from the effects of radiation therapy. So if you ask patients, what do I feel like doing? Let's go exercise. That's probably not going to be embraced with enthusiasm. But it's also important if you're able to do something even in the midst of your therapy. And no one is expecting you to undertake a vigorous daily exercise program. The message we often tell patients is do what you feel up to, and something is better than nothing. And that something may be, if you're very limited, walking around your house. If you're more vigorous than that, of course, going out for a walk. There isn't a limit. We've had people who, train for running 5K races during their treatment, even some that run marathons. And I'm not suggesting that's for everybody, but the message is that we don't set limitations on what you can do. Rather, we encourage you to do whatever you feel up to. And all of it is going to help with your overall sense of well-being as well as your recovery. And a salutary effect of all of this is that it may have a beneficial effect on reducing the risk of the disease returning in the future. And the fundamental message is anything is better than nothing. So even if you're starting from baseline where you don't do much of anything, slow progression of your exercise, just getting out of the chair and moving around is important. And then gradually going to walking down the street, walking blocks, getting out with friends to take a walk, possibly jogging, doing strength training or resistance training. All of this is going to have a positive effect, not only on how you feel, but also potentially on the disease itself. So I hope you enjoyed this Yerbba video on the effects of exercise, potential benefits, and the importance of it. So I look forward to talking to you again.